All right, we'll call the meeting to order. Thank everyone for being here tonight. Got a lot to do, going to get a lot of information, and we really appreciate each and every one of you. Now we'll call on Father Gus Christen, from the rector from the Church of the Ascension, to lead us in our invocation. Thank you for being here.
Please.
Yep.
I'd like to invite you to join me in prayer. Gracious and loving God, we gather this evening grateful and hopeful and mindful of all your blessings. This is a time in which we regather many parts of our lives after the summer, and there are many people for whom we pray, especially those we name at this time either silently in our hearts or aloud. We ask also that you bless this gathering and all who serve in this county. This is a prayer for local government from the Episcopal Book of Common Prayer. Almighty God, send down upon those who hold office in this county the spirit of wisdom, charity, and justice, that with steadfast purpose they may faithfully serve in their offices to promote the well-being of all people. In your holy name we pray. Amen.
Amen.
And now, for our pledge, we want to call on Mr. Joe Shamel. Mr. Shamel was Specialist 4th Class in the U.S. Army from 1968 to 1970. His assignment included duty in Vietnam from September 1968 to August 1969. He was assigned to the American Division of Chule, Vietnam. Along with other medals, Mr. Shamel was awarded the National Defense Service Medal, the Vietnam Service Medal, the Republic of Vietnam Campaign Medal with 60 Device and Army Commendation Medal. Mr. Shamel feels blessed to be alive after having been a patient in the 312th Evacuation Hospital the morning a Soviet-made rocket hit the Quonset hut, killing the first female nurse of the Vietnam War, Ms. Sharon Lane. When Joe returned home, he married his bride, Marlene, who I graciously served on the school board with. She did a great job. In January 1970, they have 3 daughters. Mr. Shamel, come on up and lead us, and thank you for your service.
Thank you, Ron. If you'll stand, please, face our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much. Did you want to say anything, Mr. Shamel?
Well, thank you for having veterans take a part in opening your meetings each month. You know, that's a real tribute to all Davie County veterans, and I just thank you for doing that.
Appreciate you being here. Appreciate your service. Ethics and conflict disclosure, Mr. Vogler.
Thank you, Mr. Chair. Pursuant to North Carolina General Statute 168-86 and Davie County Board of Commissioners Code of Ethics adopted December of 2019, I asked each of you before you adopt the agenda if there's any actual, potential, or perceived conflicts of interest in any matter on the agenda which will come before the board tonight for a vote. If so, please speak up and let the board know before the agenda is adopted. Mr. Chair, seeing no one speak up, I conclude there's no actual, potential, or perceived conflicts of interest by any board member. Thank you.
Thank you, Mr. Vogler. Do I have a motion to adopt the agenda?
So moved.
Ms. Finney, do I have a second?
Second.
Mr. Reniger, all in favor? Uplifted hand. Any opposed? All right. Public comment period, Mr. Vogler.
We have 2 individuals that signed up tonight, Mr. Chair. I will call each one of you, and when your name is called, if you would come to the podium, I will be timing you. I will hold up a card when there's 2 minutes left, 1 minute left, 30 seconds left, and then when time for you to stop. Ask each of you to abide by those times. Each person that wishes to speak will have 3 minutes, as I said. If you're speaking for an organization, you will have 5 minutes. You will address the board as a whole. You will not ask for any verbal exchanges back from the board. At this time, this is a public comment section, not a discussion section. And also, the first individual who signed up is Miss Julie Whitaker, here to talk to you on mental health.
Mr. Vogler, I neglected to mark on the sheet, but I am speaking on behalf of the Davie County Mental Health Advocates tonight. I won't take a whole 5 minutes, but I need about 30 extra seconds off of that 3. Okay? Good evening, everybody. Hope everybody's enjoyed their summer and are ready for fall to come on us. There are families in Davie County who are not getting mental health services and supports as needed. Respecting confidentiality, I can relate that a large company with a business in Davie has management out of state. A manager has regular contact with an employee here and learned the family is struggling since an adult with a diagnosed lifelong mental condition graduated from the county school programs and now has no place to go daily while his parents work. To help, the manager investigated supports and found my email address on the county's website. Sadly, many families have this experience and go through a long and difficult learning curve and then a long wait period before they find the services and supports needed, if these are even available. Moreover, there are some who know about the state system and are enrolled with the LMEMCOs and on Medicaid, yet still struggle to get the supports needed. Thus, the ill persons are endangered, and so are their families. So advocates suggest these metrics should be helpful to understand the full state of mental health in Davie County. Reporting by month how many clients utilize an ER because of crisis and how long are they there before they, one, either go to a longer-term facility for care, are released without long-term care, or stabilize and connected to and consistently receiving care while stable at home. How many clients aren't being served upon exit from the hospital? How many days, weeks, months did these clients wait for services, and how long before they return to the ER? How is Partners ensuring that clients are receiving adequate care from the provider? Clients are placed in provider care to receive supports and ensure safety. Are there stipulations and checks and balances that are in the contract and ensure these supports are received and that Partners can hold the provider accountable, especially if a client ends up in the hospital? How many local general practice offices are in Davie County, and how many have our LMEMCO met with and become familiar with how to introduce themselves and provide information and access to mental health services and supports? What is being done to help attract new providers to the area? It is part of the state regulation to have network adequacy. What are those measures, and how far off is Davie? How many clients have an innovations waiver yet aren't utilizing services? How many people are living with their families by default because there are not adequate options in this community for varied levels of supported living? What is the count of homeless persons in the county? What is the current suicide rate? How does that compare over the last 5 years? Do we have a count of suicide attempts? How many overdose calls does the county respond to? Has Davie County been in discussions about how to collaborate and financially support the work of the LMEMCO for the benefit of Davie recipient residents? What is the attendance of Davie CFAC representatives and the Partners Board of Director members? Finally, what more can be done to improve community supports for our citizens and transparency regarding common and frequent mental health issues? We will greatly appreciate your attention to these matters. Thank you.
Mr. Chair, the next individual who signed up is Dusty Soto, again on mental health.
Ms. Soto, can I interrupt you just 1 second? Mr. Mr. Barnett, I'd like for Jackie from Partners to make sure we get him a copy of this, okay? So he can respond in light. Thank you. Thank you.
Hi. I come to share our mental health story with you. I am a wife to my husband of 27 years and a mother to our 8 children. We have been residents of Davie County for 8 years, and this is our forever home now. 16 years ago, we adopted a set of 3 siblings that were developmentally disabled from drug exposure. When our oldest adopted daughter became an adult 2 years ago, we became her legal guardian since she functions at a 3rd grade level. In February of this year, she experienced a mental health crisis. For the first time in our lives, we had to call the police to our home. While I'm incredibly thankful for the kind sheriffs that arrived to assist us, this was a very scary experience for our other children. Our daughter was inpatient for about 10 days, but the next day after she was released at her intake counseling appointment, they suggested she return to the hospital again. Where she was held for another week. 2 weeks after returning home, we had to call the police yet again to assist us because she now had suicidal and homicidal intentions. Our daughter was again kept for another week. While she was inpatient, we had to get psychiatric care for 3 other members of our household because they were diagnosed with PTSD. They required medication due to the stress of what had been occurring in our home. The psychiatrist that saw my children told me that we could not bring this other daughter home because my other children would not be safe. We tried telling the hospital this, but we were only offered to transfer her to a homeless shelter, and we were told that we would be charged with felony abandonment if we did so. So our daughter came home heavily medicated for what they hoped would be a very short time, but it has been 7 months. We now walk on eggshells to not trigger this person that has caused so much chaos in our home. Our other children that have been diagnosed with PTSD have required increased care and appointments. My husband has missed an average of 8 days per month of work over the last 7 months. In this economy, that's been very difficult because he is the sole breadwinner for our family. Our MCO, Partners, has had 2 case managers over our daughter in the last 6 months, but neither has been able to find any services for her. Our daughter's psychiatrist felt a group home would be very appropriate, as did her pediatrician, but the MCO management will not approve group home funding. We have at least 10 years on the wait list for Innovation's Waiver before we can get help. Last month, a group home was identified in Salisbury. Partners said our daughter could go in under a program called Long-Term Community Support. After a few weeks, we lost hope because the LTCS program is actually available for ages 22 and up, and our daughter is 20. It truly feels as if there is no hope for our daughter to move out of our home so that our family can heal and she can get the services she needs. Recently, our daughter developed liver impairment and had to be hospitalized yet again for complications due to the toxicity of her psychiatric medications. Obviously, the amount of medication required for her to be on so that she can be home is not a sustainable solution. Our daughter needs a therapeutic environment. The psychiatrist says my other children will not heal while this member is in our home. This experience has deeply traumatized my family. We love our daughter and pray that she can get the services she needs. We are a Davie County that has family that has fallen through the cracks.
Mr. Chair, that's the only 2 that signed up tonight.
Okay. Thank you. Ms. Soto, do you have those notes? Did you? Yes. Could we get a copy of those? Yeah. Okay. Thank you. Thank you. I especially want our partners to get a copy of that too. Thank you so much. Mr. Barnett, presentations.
Thank you, Mr. Chairman. Tonight, we have the pleasure, twice a year, we bring forward some of our employees who we determine with the designation of going the extra mile as part of our GEMS program. The Davie County's GEM program is designed to recognize and reward county employees for excellence and service consistent with our I Pledge value statement. This program allows staff to submit nominations of their peers for recognition and a monetary gift that we give for all of our employees who have gone the extra mile. We have 6 employees here tonight that we'd like to recognize. Unfortunately, one is unable to attend. I do ask, as after we've recognized the 5 that are here, that everybody sticks around so that we can get a group picture. I want to also thank Paris Whitley, who leads the program, and Paris has a committee of Suzanne Wright, Melissa Parker, Heather Kraus, Robin Vogler, and Andy Atwood, who actually go through several nominees, and these are the 6 that they have identified as going the extra mile. So if you give me a little bit of time, I'd like to go through each one individually and have them recognized for their talents and their abilities. So the first one on my list is Chris Warner. Chris is a CPS on-call social worker. Unfortunately, Chris is the one that's not able to attend tonight. But as part of her nomination, she has been a great addition to the CPS on-call team, providing much-needed support to other social workers without complaint. Recently, Chris helped to transport children out of state all the way to Illinois and New York. During a recent home visit, she has spent hours getting down and dirty, helping children to clean a house that was not quite safe for them. So even though Chris is not here tonight, we have already made sure that she has gotten her award, and but we wanted to recognize her. Next on my list is Connie Cruz. Connie works in our Human and Health Services as an Environmental Health Processing Assistant 3. As part of her application, Connie goes above and beyond in her role at the Health Department. She is the employee responsible for verifying and certifying death certificates for Davie County and every funeral home in the county, and will tell you that she is the absolute best in the business and how grateful they are for her service. Connie is always willing to assist in assuring that death certificates are processed quickly and accurately in Davie County, and does this with dedication and compassion. The submitter said, I recently had 2 occasions where the physician had entered incorrect information on the descendant and were not responding to requests for the necessary changes to be made, and Connie worked until the information was correct. While this may seem like a simple issue to some, these cases were causing emotional distress for the families, and she was determined to bring them peace. She knows that this sensitive information is important to the families of Davie County, and there is no there should be no such errors on important documents. Her willingness to come alongside Davie County citizens and businesses is commendable. Connie's dedication to her job is only suppressed by her compassion for people. She is a blessing both professionally and personally. Thank you, Connie, for being an outstanding Davie County employee and shining example of dedication and professionalism. So if we could get Ms. Connie to come up. Next is Donald Jones. Mr. Jones is a detention transport officer with the Sheriff's Department. As part of his nomination submittal, Officer Donald Jones goes the extra mile on a continuous basis. He works an 8-hour shift, sometimes being on the road for several hours of his workday. Teamwork is important in his daily duties, and Officer Jones proved himself to be a team member. After completing his shift and already on the road going home, he made the decision to come back to the detention center to help his colleagues clean up a mess, which he said, I can't go home knowing the officers are shorthanded and need help cleaning up this mess. This is just one of the many occasions Officer Jones has stepped up to help his colleagues. So if we could have Officer Jones come up. Next is Jessica Hoser, who's a permanency planning child welfare social worker. Jessica assisted a teenager in achieving his dream of completing driver's education. The child had experienced numerous challenges in foster care, ranging from athletic disruptions, sibling separations, and moving out of Davie County, a county that he certainly loves. As part of the application, typical milestones are awful hard to achieve for children in foster care who have the highest rate of placement, instability, and educational changes. For this child, Jessica advocated to the school professionals, Davie County Department of Human Health Service staff, and placement representatives for the child to remain in their placement until he completed driver's education despite the availability of a new, more long-term placement. Would have been easier for Jessica to move the child more immediately? Yes. But the extra work, hours, the commuting, and administrative burdens would have been significantly reduced in the face of overall caseload demands, extended work hour responsibilities, but she did not choose the path that was the easiest for her. She chose the path that was best for the child. Jessica takes advocacy for children in foster care seriously. She strives to provide normalcy and develop trusting and meaningful relationships with children in placement. Jessica uniquely understands that her work is key to the long-term success and trauma reduction of our children. So we could have Jessica come up. Next is Greg Forbes. Greg is our new community paramedic. As part of his submittal, Greg is very passionate about helping Davie County citizens and all people he comes in contact with. He works fervently to offer treatment options to substance use disorder and mental health patients. In fact, he goes the extra mile working with these patients, and many shifts he has worked extra hours to ensure a patient got to the appropriate facility and received immediate treatment. Greg always offers to help his coworkers, has a smile for everyone, and overall generous and gracious attitude. And lastly, we have Kimberly Hefner, who is our fiscal officer with Human and Health Services, DSS Business Operation. Kim's expertise and knowledge of both county and state level operations is truly unmatched. Recently, Kim has simultaneously managed several intensive and demanding audits, including the federal compliance and fiscal accounting audit. She was able to pursue the information from various perspectives while maintaining a concrete foundation of integrity and understanding. For example, upon Kim finding out that worker capacity was possibly going to result in delays in foster parents receiving payments, Kim spoke directly with several parents to discuss their anticipated hardships. Kim even took the initiative to hand-deliver checks to ensure a timelier recipient of the needed monies. Due to Kim's vast scope of knowledge in the interlocking components of programmatic and fiscal operations, she is invaluable in her unique and integral skill set. She's able to take the time and explain programmatic guidance and their interference for the benefit of creating a better team strategy and understanding to prevent crisis or paybacks. Kim would come up. That's the last one. And as the commissioners are getting set up, I'd also like to thank everyone, whether it's staff or family, who came out tonight to support our employees who have gone the extra mile.
Okay, now we'll hear from our health partners here. Mr. Copeland.
Good evening, all. Thank you very much. I didn't get a chance to meet with Ms. Logan beforehand, but I say she's got me taken care of, so I'll go ahead and I guess she'll help me through this. Good evening, Commissioners. Glad to be here this evening. I'm representing Partners Health Management. Thank you for the opportunity to give you a little update on how things have been going. It's hard to believe in November we'll be approaching 2 years as your local entity managed care organization for Davie County. So we're excited what we're working on and got some things to continue to work on to get better at, as I think we all know. Already? Okay. Great then. First, I want to give you a little update on members. That's the focus of what we do. We serve members, and so I wanted to share a little bit about the members and how that process is going. As far as the numbers we've served, you see we've served over 584 individuals here in Davie County. And this is based off looking at from a last 6-month period. With that, what we also share with you is our penetration rate. That is those members who receive Medicaid, and want to get into services, how many we engage in that process of time. Right now, our year-to-date Medicaid penetration rate is at, you see, 23.8%, almost 24%. Just to give you a little make comparative for you. Typically what you aim for in our industry is from 19 to, or better said, 1 out of 4 people who are in that population, especially for managed Medicaid, that they have access to service of receiving services. So we're right in that ballpark there. If you look at that on a state level, Partners tends to be either number 1 and 2 in the state amongst our LME MCO peers when it comes to penetration rate. Our rate as an area is we're really focused on that. That's what we kind of heard. There's some areas that we're going to continue to improve on and get better at, as you see. And next, I want to talk a little bit about those members who are state fund recipients. And just a little reminder, these are individuals who have no insurance and qualify for one of the state's identified eligibility pots of funding. In that case, we're able to use those funds to serve them. We've served 202 of those individuals here based off last fiscal year 23. And our fiscal years, we look at them, fiscal year 23 is actually fiscal year 22 to 2023. Just to give a little orientation of that. This may be a great time. I added this. One thing we're also wanting to do is add a new slide, new information for you to look at. And that is related to initiation and engagement. Essentially with that, what we wanted to be able to give you a picture of is going beyond just, okay, you have people who have Medicaid and they have started the process or want to have began receiving some type of services, behavioral health services. What we want to share this is a metric that's utilized nationally in the state to say, okay, those people who want to engage in services, how are they really engaged in them? Because studies have shown that initiation, meaning if a person can, once they decide that they want services, if they can receive 2 or more services within the first 14 days, they tend to do better long term. And then for engagement, it's saying once they have that initial initiation and start services, if they can have 2 or more, or total of really 4, within the first 30 to 45 days, they tend to have better results long term. So that's why we thought I'd share this data with you to give you an idea how we're doing in Davie County. First, looking at that initiation from folks who have mental health, we're at about 38.3% rate. For substance use, we're at 18.18%. And I put an asterisk there, and I gave you more data because that's a little anomaly. Typically, we're ranging in a little bit higher range when it comes to especially substance use in regards to initiation, and also true for engagement. We always look at trend data, and this may be just one of those trends that we trended down for that time period. Again, we're speaking to January of this year to March 30th of this year. And so I want to kind of give you some food for thought. If you look at the second quarter, which will be October to December of 2022, our initiation rate was around 42.48% for substance use. So it's a little dip, but we typically fall in a range of 19 to up to 30, the low 30% mark for that piece. Now going to engagement. Again, this is folks who, if they had that first service, they've had 2 or more services within the first 30 days. Mental health wise, we're at 14.89%. And substance use, we're at 9.09, a little over 9% for that one. So again, we're looking at the substance abuse one, along with the mental health one also. Engagement tends to be a challenge because for a lot of variables, people come in, they receive one service, they may not follow up for the second service. They could have some social determinants of health, meaning they have a problem finding food, finding shelter, transportation, those things. But we're trying to look at ways to kind of address that so we can increase those numbers up so that they can get engaged and stay in services. Again, national efforts, again, say if you can get people, we're striving to get people in the high 30s to 40%, or all at once, we try to get them into services based upon the ability to do that with. Next, I want to talk a little bit about our care management. Care management is how we help members who have very complex needs, how we work with them and try to get them the services that they need. But at the same token, what are the other systems that they interact with? For example, again, a good example is with children. They may be involved in the behavioral health system. But at the same token, they go to school. Along with that, they also may interact with other systems, sometimes juvenile court and other systems. So we try to help the family whatever way we can with these type of children who truly need this level of care. So for the IDD Care Management, those are the folks who have an intellectual developmental disability diagnosis. We have about 188 we're working with right now. For the innovations waiver, and those are the folks who have qualified and are been given an innovation slot. I've talked about before, those are very limited based off funding. It's a next level of service that's available to people who have submitted the necessary information evaluations, and a spot is available, and we have about 43 members now who are on that innovation waiver list. We're hoping, we had a few additions, as you recall, from last year. I think we added 3 for Davie County. We're looking, hopefully, the General Assembly will allocate more dollars for more slots. That's totally determined on funding from the Department of Health and Human Services. I know there's been a lot of advocacy of asking them to add more dollars. So we're excited and hope to see that come to fruition because it'll be helping to move more people off the waiting list.
Jackie, do you
Yes,
know how many
Commissioner
people are
Finley.
on the waiting list right now?
Yes, ma'am, I can go to that right now. Right now, we have 81 individuals who are on that waiting list.
Okay.
Too many, we know.
That's right.
One of the things that we've tried to do, if I'm going to go, since we're here, I'm going to go ahead and talk about this. We call that list a registry of unmet needs. And that's a term the state utilized for those folks who have met the criteria for the innovations waiver list. They're just waiting for a slot to come available. We keep up with them. What we do is we take their information, we time stamp it, so that when a slot does come available, it's first come, first served. We just feel that's the most fair way to do that process. We have quite a few members, so you see 81 on there now. One thing we've done is we've really worked with various community advocates, the mental health advocates, along with Ms. Suzanne Wright and her team and the schools to really make people more aware of the innovations waiver. Because as you can imagine, because the number on, the sooner, if you have a child with intellectual developmental disabilities, and you get them on that waiver, it puts them in a better position when a slot comes available. So we've developed a kind of a one-pager document called a roadmap for innovations waiver, and we have distributed that to the schools just a couple of weeks ago. last month, I think, we actually met with the Davie County Schools Exceptional Children's Services, their team. Jennifer Custer kind of set us up, let us come in and kind of share about that. We've also made available copies and distributed to the schools at some of their various school fairs so the parents will know. I think some of that, along with, I must give a little credit to Guynette and Ms. Julie, some of the work they've done, made the awareness there. We have 12 families who are being added to that list. So that's the key, to make awareness for that piece so they know about that. One thing we try to do is, because it is a waiting period because of the wait list itself, what we've also done is really made a focus of saying some of these parents, families have access to other services if they have Medicaid or state-funded services. So we're encouraging them to avail themselves to those services while they wait for a slot to come available. So thank you for your question. Kind of touching on a few things we're trying to do, again, to address that wait list that we're up against. Next, I'll move on then to what we're doing on the training front. We've been really working, as you see, several trainings that we've had just since March of this year. I won't touch on all of them. I'll touch on a couple. One that we've talked about before here, the crisis intervention teams. As you know, this training, crisis intervention team training, is a training for first responders. And what we have done is partner with the Sheriff's Office and starting to put those and hold those within Davie County. In the past, different first responders, Sheriff's Department folks were going to surrounding counties, either down in Rowan County, over in Forsyth, over in Statesville, up in Yadkinville. And so now we've had 3 of those trains so far this year. I think the last time I came, we had our first one. And since then, we had 18 then, we have 20 more. We completed a couple of weeks ago, we completed our next graduating class. So we're excited what we're offering here in Davie County. And to continue with that on, we also have a training coordinator at Partners who she helps put those on, helps facilitate that. And she also, because of that, decided to move to Davie County several months ago. So she's definitely here in the county, and we hope she'll be able to interact with more different partners and provide more training in the community on these and other subjects, other training topics. The next training I'll point out is the question, persuade, and refer. This is a suicide prevention training model, a national model that we train in our 14 counties, and it's done all over the country. What we've been doing is really pushing, offering that training out there, just because, as we all know, the increased number of suicides that we're receiving is not going down, and it's spreading to new populations, increasing rates of suicide attempts. So this is a great training for anyone in the community who doesn't want to become a mental health professional, but just be able to know some questions if they see someone going through a mental health crisis, how they can ask some questions, kind of persuade them to talk to someone about their mental health professional, and then help them understand who they can go to refer them to. We just feel there'll be a way to really help mobilize regular citizens to help each other out when they see someone's going through a challenging time. Final thing I want to talk to you all about is, I know the last time I came, back in January, County Manager Barnett asked me beforehand to talk about some of the projects that we're working on, so I laid those out. So I thought I'd give you an update on how that process is going. Some we've had still working on, as you see by the empty check box, and you see some checks we had some good progress on. First I'll talk about is adding recovery housing within Davie County. There are resources outside the county, but a big push to bring that into the county, especially for those folks, because we've had some grant funds that we are allocating to that. Those individuals who are reentering the community from some type of incarceration, be it the local jail or be it at a prison and coming back into Davie County. Some sober living for them, because these individuals would have some type of substance abuse issue. We've had some great meetings. I partner with Ms. Wright on this, and Suzanne and I have met with a couple of groups We're really close we've got one contract in for a provider that does this, Oxford Homes. They do it across the state. They're just still trying to locate a facility that they can acquire to do that with. As you can imagine, find the right place for someone, and at the same token, in this housing market, it can be challenging, but they're continuing to work on that one. Next, some things we have got done. Last time I talked to you about a dashboard we were putting together of key performance indicators specifically for children who are in DSS custody who have behavioral health issues. Just the way that social service can kind of see what we're, for the kids that are your kids that we're working with, just how they're doing. And so we've put that in place, and we share that quarterly with the DSS directors. I think we actually have meetings set up for later on this month to kind of talk about on a county level just where their kids are, what service, what type of diagnosis that we're seeing, and just where they're being served at. The next item, TAIL plan implementation. You've probably heard, I think I came last time and said we were expected to be operating a TAIL plan. The Department of Health and Human Services has delayed that. So we are ready to go, but they have delayed that start date. So we'll have, hopefully, we're looking to, when that is approved, we can get started with that, because it really offers us the opportunity to go beyond just the behavioral health, but also serve the physical health and serve the whole person. So we're waiting in bated breath for that to start. Next is tailored care management. That's something that's in place. It'll expand. All those who are Medicaid tailored plan members can, if they choose to, they can have that. Again, that's kind of held in limbo, but we decided to start providing more of that just because the need that's out there, so they can begin dealing with and working with those individuals with some very complex needs to kind of help them identify world ways we can help them and get them navigating the system. And beyond just mental health or substance use or intellectual development disabilities, but what are the other barriers, as I mentioned earlier, like social determinants of health, housing, transportation, food, just safety. So we've kind of started that, even though the state hasn't given us the green light yet. And next, we've also started educating primary care practices and doctors' offices about partners. I know that I've had some discussion with folks about why didn't you start that sooner. We ran to, the state asked us to hold off on that. Now we've got the thumbs up, so we've been having those meetings, sharing documents with them, just how to contact our Partners Access Line if people, some of their patients need behavioral health services. And also, I mentioned earlier, the roadmap to innovation waiver, also sharing that too with them as they're working with patients, they can share that information with them. And then finally, I kind of talked about this, the CIT training, we're excited. We've had 3 of those so far in the county. We'll be working with the Sheriff's Office because I mentioned earlier, it's beyond the Sheriff's Office, but the Sheriff's also invited and they participate. Some of the EMS also has went through CIT, those who haven't been through it yet. And so I think some of the Sheriff even brought in some of his dispatch staff to also train them because they deal with the calls in the front end. And CIT does have a model that works with those folks too on learning how to kind of support the officer in the field and the person on the line most of all. So that's a little bit of what we've been doing as far as projects and plans. A couple of things, then I'll let you, I think you're going to ask me a question and tell me to sit down one, so either way. One thing I want to let you all know is we had a change in staffing. We had a staff member who's semi-retired, Mary Beth Young. She was our system of care community engagement specialist for Davie County, and we've hired a new one named, you may know him, Gary Marshall. He is now working here in the county. We're excited to have him. He brings a wealth of knowledge, and we're glad to have him. So you'll be seeing him around at various meetings and what have you. So he'll be sure to walk up and shake your hand and introduce him if you already don't know Mr. Marshall already. And final thing is just a reminder that be looking for various information about September is Recovery Month, a National Recovery Month. So be looking for that and some of the events that we're going to be having related to that. So that concludes my presentation. I'll be happy to try to answer any questions.
Thank you so much. I tell you, we really appreciate the level of communication you bring back to us. I know we only do this a couple times a year, but in the last 2 years, we've probably gotten more communication than we had in the previous 10, so I thank you for that. I will say this, Mr. County Manager, Mr. Manager, Ms. Soto was brave enough to come here and talk to us about her story. I know you have thousands of stories, but Ms. Soto came here and talked to us in Davie County about her story. I would like some, and I know this is medical, you can't give us specifics, but I would like to have some kind, and I think the other commissioners would too, like to have some kind of update on what we're doing for this family. She mentioned the issue of the innovation waiver, 10 years, whatever it might be. That's your realm, that's not mine. But you're a great person and your organization is outstanding. I just think we would like to hear kind of where we are with Ms. Soto and her family. Ms. Whitaker gave you a lot of ideas and thoughts. You were mentioning many of them. I think Robin got Ms. Soto's notes. Karen has them. If you could just make sure that Mr. Copeland gets a copy of those. And then if you would, I know you're going to follow up with Ms. Soto. If you would follow back up with us, we would greatly appreciate it. Thank you for all you do. Guys, any other questions?
I do have one quickly. Medicaid expansion, I know that's all tied to the budget, and I know we're all anxiously waiting on that. But on the tailored plan, during this delay, is any criteria for being eligible for the tailored plan change, or any of your relationships with the vendors, has any of that got a sunset on it, or?
Not at this time. What the big push on our end, and is we've been focused, make sure we have contracts in place with providers, obviously, especially medical providers, because typically we didn't have we didn't have contracts with hospital systems. We did. We're working right now to soon finalize a contract with one of the larger ones. That once they get in place, things kind of fall into place. Challenge we face is, to your point of the delay, some providers have chosen to just wait to sign contracts. We're having communications with them on a regular basis, trying to give information to them, but they have decided that they want to wait for business purposes. They want kind of wait, to your point, to see will any changes take place that may change their perspective about wanting to join a network. We haven't heard any as of yet, but we meet with them on a regular basis. At least monthly, we have a provider forum where they can come in and share their issues. And then we also have a provider council, which is a small group of kind of those key entities that want to, key providers that want to advocate on behalf of their other peers. So far, no. We're still just getting ready and waiting to kind of get started. The Medicaid transformation expansion piece, we're working with the Division of Health and Human Services to figure out how many more lives would that mean being covered. Medicaid eligible folks will be covered. You probably saw some of the news about over time some people have kind of lost their Medicaid coverage because the decision hadn't been made yet. We're constantly communicating with members. Once we have given the list, we're trying to communicate with them if we have the information directly or place the information on our website so that they can be able to look and find that piece.
Thank you.
Other questions? Thank you so much.
Thank
We
you.
really appreciate you.
You're welcome. Before I take my seat, we'll most definitely, or with DeSoto, work with her and her care manager and her to try to find out. We'll try our best to communicate back. As you mentioned, we have some privacy laws that we have to be mindful of, but we'll try to give some kind of update to y'all know that we're working with her and her and her daughter and her entire family.
Thank you.
Thank you.
Thank you. Okay. Next, we'll have Ms. Bodenheimer from the Guardian Ad Litem Division. Come on up.
Good evening. Thank you all so much for letting me be here tonight. I come to Davie County every chance I get. And I want to know if you've ever heard of the North Carolina Guardian Ad Litem Program. If you have, I'm glad. If you haven't, I hope you'll remember us after my brief talk with you this evening. My name is Laura Bodenheimer, and I'm the District Administrator for the North Carolina Guardian Ad Litem Program here in Davie and Davidson counties. We're the 22nd Judicial District, consisting of Davie and Davidson counties. I'm also an attorney and practiced alongside many years ago. Mr. Ed, it's good to see you again. I know he worked with us in our program years ago, so it's always nice to see you again, Ed. I live in Davidson County, but like I said, I come to your beautiful county every chance I get. So what a lovely and inspiring beginning to our meeting. I certainly appreciated that, and I appreciate all the work that you guys do for your county as well. I want to give you a little brief history about the program and let you know that we are 40 years old this year. In 1983, the North Carolina legislature said that every child in North Carolina who enters into the court system through no fault of their own, by way of an abuse or neglect petition, is entitled to their own representation. They get their own voice and their own space at the table, which was a pretty revolutionary idea at the time. And so the North Carolina Guardian Ad Litem Program came to be. It took a few years, but eventually the legislature provided that in each judicial district there would be a Guardian Ad Litem Program. It would be staffed with state employees, but the work would be done by volunteers. And that was pretty revolutionary at the time as well. These volunteers would simply be community citizens who would be recruited, screened, and equipped by the paid staff to go out, see our kids, write a report, and then paired with an attorney, present the child's case and recommendations to the court. And I will tell you that in speaking with each of our judges, they would tell you that they cannot do their job without us. They may not always see things the way that we see, but we are responsible for bringing the child's information to the court, and we rely on our volunteers to help us do that. I want to share a brief story with you about a man named Joel. Joel came to me and said he wanted to volunteer and give back to the community. He was retired, had been in the military, and pretty cool fact about him, he invented the little touch pad that the UPS guys used to give us to sign for our packages. So Joel said he was nervous, but he wanted to give back to his community, so I paired him with a 5-year-old little boy named Carl. And Carl had seen the worst of the worst by way of living with his mother and his grandmother. He had seen his mother shoot drugs up her veins, and he'd been with his grandmother while she shoplifted to support their habits. So in walked Joel, this man who was bigger than life, and introduced himself to Carl, and they were immediately smitten with each other. I went with Joel the first time he met Carl because he was nervous, and I couldn't believe it. But the first time Joel and Carl met each other, they were smitten with each other. And so this began the journey of Carl's exposure to the juvenile court system. And Joel, being his guardian ad litem volunteer, was the only one who advocated that he should not return to the life of chaos with his parents, with his mother and his grandmother. And so it took a couple of years. And during the course of that year, Joel asked me if he could go visit Carl in his kindergarten class, and I said, sure. He said, I want to read a book to him, and I said, well, ask the teacher first. So Joel went to Carl's class. All the little boys just gravitated to him. He read the book over and over again, and finally the kindergarten teacher looked over at him, and he said, I need to wrap this up. So Carl walked Joel to the door and held his hand, and just beaming, and said, will you come back? And Joel said, of course. So Carl's case goes through the court system, and Joel continues to advocate that parental rights should be terminated and that Carl should be adopted. Finally, his adoption day came, and Joel was there. Carl made a new family with his adoptive family. And Joel said, I just couldn't hardly stand it, but I was so happy to be there. And so when everybody was convening and the adoption ceremony was over, Carl reached up and grabbed Joel's hand and said, this is my best friend. And Joel said, this is why I do this. So he's telling me the story. We're both crying. He said, well, I cried. He said, I had to step outside, and it was just an amazing, amazing event. But he said, this is why I advocate for these kids. And I want to read you a couple more quotes from our volunteers that are on a poster board in our main office. This is fun, frustrating, and fabulous. It's the best use of my time. Children are our business. It's the toughest job you'll ever love. And being a GAL is such a blessing to me. Now, Joel and these folks who wrote on our board are but one of 13 community citizens from right here in Davie County. They heard our story about GAL and said, yes, I can do that. These amazing 13 community citizens advocate for, on average, 45 abused and neglected children here in Davie County. These kids are in foster homes, relative care, group homes, and sometimes in their parents' homes. These 13 volunteers, one of whom is our very own amazing Kelly Funderburk, they give about 260 hours per month to these littlest victims. I think that saves us a lot of money. And they truly do this out of the goodness of their hearts. They appear in court 2 days per month. They attend countless meetings on behalf of their children, and they show up wherever their child finds themselves. Now, unfortunately, out of those 45 children, we have about 14 youth who do not have a guardian ad litem of their very own. They're waiting for a person. They're waiting for a champion. They're waiting for an advocate. So that's why I take every opportunity that I'm afforded to talk to our community leaders, such as yourself, to make sure that you guys know who we are, what we do, and why we need more folks to join us. You may be saying, now, where are you guys? Well, our main office is in the Davidson County Courthouse, the new addition. All 3 of our staff members have offices there. And we also have an office right here in the courthouse, upstairs, with a great window overlooking the town. One staff member is here part-time, and we are very appreciative of any space that our counties provide us to do our work and to welcome our volunteers. And I want you also to know tonight that I don't come to ask you for anything. We don't ask for money, extra funding, or more resources. We are richly blessed with what we do have. But rather, I come to you to ask that you know us, to remember us, and to help me spread the word that the North Carolina Guardian Ad Litem Program exists. We provide an invaluable service to the abused and neglected children right here in our own community, and we provide an awesome opportunity for everyday people to impact a child's life in a way that is unmatched by any other agency or organization. Our volunteers are numerous, and their hearts are bigger than the world. They inspire us every day. It's why I go to work every day, and it's why I became the district administrator for our program. You have a folder with some information in it. Please look it over. If you're inclined, join us. If you're not, then pass it on. I'm sure there's someone in your circle who would be interested in joining our team of advocates. Thank you so much for your time this evening. I know you're busy, and I know there are lots of things pressing, and we are but one volunteer opportunity in our community. But as I tell our folks, if you come join us, you'll be blessed and you'll be a blessing. Public service is often thankless, but nonetheless rewarding. And as our former President Ronald Reagan said, we can't help everyone, but everyone can help someone. Again, thank you so much for your time. I thank you to Karen and to Brian and to Kelly for helping facilitate me being here this evening. You guys are some wonderful public servants, and I am blessed to know you as well. Remember the North Carolina Guardian Ad Litem Program, if you will. We do exist. We're right here in Davie County, and we represent abused and neglected children in juvenile court. Thank you.
Thank you.
Thank you. Any questions from Ms. Bodenheimer?
I don't have a question. I do have a comment. I'm so glad that you're here sharing with us tonight, because I personally know of a case that a guardian ad litem is supporting a foster family, and that's about the only support they're getting. The court system is not being very wonderful to them or to the child, so I thank you for what you do, and I thank all of the volunteers for what they do for these children. Thank you.
so much.
What is the age range?
Birth to age 18.
Okay.
Most of our children right now are in the middle school range. It seems like babies. Substance abuse, of course, is our biggest obstacle, and then babies, and then most of our middle schoolers.
But those 45 you were talking about, they're in Davie County.
Yes, sir.
Okay.
Seems small. Seems like a small number, but one child is
Well,
too many.
That's a lot.
Yes, sir.
Thank you.
Thank you.
Anything else? Thank you so much. We really appreciate you.
Have a good evening.
Thank you. And now, Robin. Thank you.
Good evening. Tonight I'm going to talk to you about the July 2023 financial report. It's on pages 10 and 11 of your agenda packet. This report compares July 2023 with the prior year of July 2022. Comparatively, we collected $2.2 million of revenue. That's about 2.65% of the budget versus 2.43% of the budgeted revenues compared to last year, the prior year. For expenditures, we spent 8.51% of the appropriations for the general fund versus about 6.55% in the prior year. Just for a frame of reference, 1 month's worth is 8.33%. Since we only have 1 month down so far in this fiscal year, we're about 1 month's worth that we've spent so far. So let me know if you have any detailed questions about this report, and I'll be happy to answer them.
Any questions?
I just have a trend question.
Yes.
Trend question. So we're ahead of where you thought we would be.
Yes.
Okay. And what's your crystal ball say?
The crystal ball for July is always too soon to tell because you only have 1 month down. We did send out tax bills a month earlier this year than we did last year, so those collections are better than we did see, through July of last fiscal year. So that's promising. We did see some spending a little bit more than last year just because departments are feeling some supply chain pressure. So they wanted to go out and get, what they needed to get. So, we're still experiencing a little bit of that for vehicles, specialized vehicles, that kind of thing. So, again, July's a little bit strange to look at just because it's kind of too soon to tell. Tax revenues haven't really started coming in yet. That'll be more important later on in the fiscal year.
Thank you.
Other questions? Thank you, Robin. We look forward to these monthly,
Sure, yes.
or at least we hope we look forward to it. Item 8, County Manager's Report.
Yes, thank you, Mr. Chairman. A couple items I wanted to address tonight in the meeting, most of which are very positive in support of our departments. The first, I'd like to point out the Sheriff's Office recently, as part of last fiscal year, took some of their crime statistics in relation to cases being solved and completed, and we had a higher average statewide compared to our neighbors of Iredell, Yadkin, Forsyth, Davidson, and Rowan County. In terms of cases cleared, we had 42.6%, whereas the state average was 26.2%. In terms of violent crimes, we were at 26.3% compared to the state of 12.9%. And in property crimes, we were at 28.8% cleared versus 15.1% from across the state. So in terms of, number one, we do have a relatively low crime rate, but in terms of the crime that we are seeing in the community, our Sheriff's Department is solving those cases at a higher rate than we see across the state. Next, when our Register of Deeds isn't being our Register of Deeds or being a Guardian Litem, she has just been elected as the District 3 Chair of the North Carolina Association of Register of Deeds for this fiscal year 23-24. District 3, this is pretty impressive for Davie County. As I've told all of our staff, anytime that we can share our Davie County dominance across the state or the nation, that we should. But District 3 comprises of Davie, Davidson, Iredell, Rowan, Forsyth, Stokes, Surrey, Anson, Union, Mecklenburg, Cabarrus, Yadkin, and Stanley counties. So congratulations, Kelly, on this great honor. And she's also, if you didn't know, we are hosting the District 3 Register of Deeds Conference, and Kelly is the chair of that committee. So I don't know when you have time to sleep, but she is
Same thing.
quite busy. I want to say a big thanks to our folks in General Services, Brad Blackwelder and his crew. Recently at the Davie County Art Council at the Brock, they had a situation involving a water leak that caused quite a mess as part of the ceiling caved in, and Sydney Suggs, who runs the Art Council, personally wanted to thank them for their hard work and being able to get them back up and running in a quick and efficient manner. I want to send a thanks out to the Dragonfly House. They assisted our child welfare. We had a very unique situation in one of our families when we had a difficult time pairing up Middle Eastern logistics support, and they were able to pair us up with an interpreter to help us carry out what we have to do in child welfare. So I want to say thanks there. September is National Preparedness Month, so I'm sure our fire marshal and emergency management want to remind everybody to make sure that we are doing everything that we can to be prepared for whatever may be out there. make sure you have a plan in place. We've recently seen hurricanes, wildfires, and even some of our crimes scenarios. So we want to make sure all of our citizens have a plan in place for anything that may be out there. And then finally, I want to talk about a topic that we've talked about quite a bit in the last few months. I want to point out some very positive statistics that are going on at the Davie County Library. Number one, we've had a partnership with the school system to promote homework help and test prep. Over the last year, we've had over 24 unique cases of either students using our facilities for test proctoring or getting additional help. We personally set a goal of 100 youth programs at the library, and over the last fiscal year, we had 222 programs. We've increased our volunteer hours over the last fiscal year to 628.5 hours. And then our big accomplishment this summer is part of our summer reading program that ran from June 3rd to July 29th. We had 50 sign up for the program that are our pre-K ages. We had 375 pre-K through elementary school, 69 middle school, 21 high school, and even though when we think of summer reading, we may think of our children out of school, we had 203 adults sign up for the summer reading program. We had over 5,000 participate in various events as part of summer reading. We issued 167 new library cards. We had 52,000 minutes of reading in the months of June and July. And as a numbers person, the biggest number that jumps out at you, when you compare this summer to last summer, we had a 308% increase in participation. So wanted to make sure that that was known in the community. I want to thank the staff at the library for the hard work in this program. I had 2 at home that participated. So I know exactly, I got to see firsthand of what it takes to run a really good program like this and the benefit of keeping our kids educated and well-maintained over the summer. So I know that was a lot, but that's my report.
Any questions? All right. Next, let's move on to the consent agenda. Do I have a motion to approve?
So moved.
Mr. Poindexter, do I have a second?
Second.
Ms. Finney, all in favor? All right. Any old business? Okay, seeing none. Under new business, we just placed in here, if anyone has any questions or comments in regards to the growth, commissioners, to the growth and development work session that you want to ask, Mr. Easter is here, Mr. Barnett. Not saying we have to, but we wanted to at least give you the opportunity to as we move forward here.
I guess the schedule for the community workshops or the community input sessions, I guess that schedule will be coming out in the near future.
Yes, sir. I was actually going to say, if nobody had any questions, that me and Mr. Easter are working on putting together a round-the-county type work session that will be open to the general public to just drop in and provide any additional feedback that they may have on the direction that they would like to see within the county in terms of growth and development. We hope to have that schedule. We hope to have it out before the next meeting, but we will definitely have it ready to go for the next meeting.
Okay. Any other questions? All right. Commissioners' comments. Ms. Shove?
Just like to thank everybody for coming out tonight. We appreciate your participation. It's part of what makes good government. Like to just say a couple things about the growth workshop, or at least that is, please come to these workshops. Please, or the comment sessions, and bring up ideas, comments. We need to hear that, because part of what we're trying to gauge, obviously, at this point is what the public wants, not what a vocal minority wants. Thank you.
Mr. Poindexter?
I'd also like to thank everybody for coming out tonight. It's good to look out there and see an ocean of faces. Congratulations to our GEMS winners. I think most of them have already gone. Thanks to the county employees who do such a wonderful, wonderful job. And congratulations, Kelly. We appreciate all that you do down there. And thanks to all the people in the county who volunteer their time to help keep this county running in the direction that we want it to go. Thank you so much.
Thank you, Richard. Terry?
Thank you, Mr. Chairman. Appreciate everyone coming out. Congratulations to the 6 GEMS winners, very deserved. It's hard to believe that fall is fast approaching. I was at the football game Friday night, and there was a tremendous amount of energy with school starting and school spirit, so that was, enjoyed that immensely, seeing a lot of faces. But please come back next month. Thank you.
Benita?
Thank you, sir. I also want to thank everyone for coming out tonight. Ms. Soto, I really want to thank you for sharing your story. I know it's difficult to share a personal tragedy such as that in a public forum. And I know it's hard to live in a household that way, and I hope that somebody will help you soon, and help your children recover from what they've been experiencing. I hope everyone had a great Labor Day. Summer, I guess, is officially over. It's time to go into the busyness of fall, and congratulations to all of the GEMS Award winners. I know there are many, many employees in the county who go above and beyond, but it's very nice to acknowledge some of our employees that do so. And I personally know several of the winners tonight, and I know they go above and beyond each and every day. Way more than what their pay grade calls for. We had a great growth session. We soaked in a lot of information, but we have a long way to go. We have a lot more discussions to have, and I, like Commissioner Schoaf, I hope that people will attend the meetings. It's great to hear all those numbers from the library, and I want to, is Karen still here? Yeah. I just want to give a shout out to Karen Martin, because she is just awesome. And everything she does at the library, she is just joyful and full of energy and going an extra mile and everything. And she had a Bluey event one Saturday, was it, Karen? Yes. 300 people, 300 children came to the library that morning for a Bluey event. So I just think that's incredible. But I love to watch her in action, and she does her job from the heart, when she could be staying home being retired, because she's already done this with children in the school system. So very grateful for her. And I guess that's all I have. Thank you all for coming, and I hope that you will come back. It's wonderful to see people in the audience here to see what's going on.
Yes, go ahead, Richard.
I have one more thing I'd like to add to it. I thought Mr. Copeland had slipped out a while ago, but I see him sitting over here. Thank you so much for all you do for Davie County and for partners and all the work they do for us. I know a lot of times needs are more than what our funds are we're able to stretch across. But we thank you for all that you do and for coming to report to us.
Anything else? Well, thank you everyone for being here. We really appreciate it. We appreciate your input. We appreciate all you do to really to make Davie County the great place it is to raise a family and to live. Now we are going to go into closed session. Pursuant to NCGS 143-318.11A6, to consider the qualifications, competence, performance, character, fitness, conditions of appointment, or conditions of initial employment of an individual public officer or employee or prospective public officer or employee, or to hear or investigate a complaint, charge, or grievance by or against an individual public officer or employee. And as soon as we're done in there, we will come back into open session. Do I have a motion for closed session?
So moved.
Ms. Finney and Mr. Poindexter, all in favor? Okay, we are in closed session. All right, do I have a motion motion to go back into open session?
So moved.
Richard, do we have a?
Second.
Brent, second, all in favor? Okay. Motion to adjourn?
So moved.
Second.
Anita, Richard, all in favor? We stand adjourned.
And the